So I'm an HLA lab technologist. I'm a senior technologist in the lab. There's probably about 10 technologists that work here in our department. And we're responsible for doing all of the testing for renal and bone marrow transplant. All of the work that we do here in HLA is learned on the job in this department. So basically there's 3 tests that are done for kidney transplant. We do typing, we do cross-match, and we do antibody testing. So when the recipient and the donor first come in, they both would get a typing done. And then we would run a cross-match where we put the recipient's serum sample with the donor's cells, and we incubate it to see whether we get a reaction between the donor and the recipient. And then on top of that, we run antibody testing. That's a separate test to see because sometimes the cross-match isn't as sensitive as our antibody test, and we can find antibodies in the recipient's blood that might be towards that donor. So if even if the cross-match is negative, sometimes it's still not a transplant that they might go forward with because the patient actually still has antibody towards the donor. We run all of those tests, and we do them in stages. So there's an initial process, and then closer to, if the donor and the recipient are looking like a good pair, and they're matching or going to be good for one another, then once we get closer to transplant, we actually redo all of that cross-match and antibody testing just to make sure nothing's changed in the patient's profile that might change those cross-match results or the risk for that transplant.